next stage. So a careful, calibrated, stepwise exit from lockdown with putting in place public health capacities, putting in place community capacity, building the capacity of the health system to cope should the disease bounce back up. That's the safe path out of lockdown. We want to achieve it as quickly as possible. And we want to avoid many countries going into that circumstance. And we still have many countries around the world who are not in a lockdown situation. In fact, their epidemiology would suggest they can avoid the worst of this. And we need to support them to avoid them going into that situation. The most damaging lockdowns are in many developing countries where people, as the DG has said many times, can live from hand to mouth, not from paycheck to paycheck, but from day to day. And we have to find adapted solutions around lockdown and around disease control in vulnerable peri-urban populations living in poverty, in poor rural communities. And we have to find other ways to manage, alternative, adapted ways to manage lockdowns or slowdowns or shutdowns in those situations.
Thank you very much. So this was Kate from BFM Radio from Malaysia. Now we will go to Nigeria with Metro Star, and it's Innocent. Innocent, can you hear us?
Thank you. Can you hear me?
Not very well, but we will try. Please go ahead.
Okay, thank you for taking my question. I have two questions to ask. One, how will WHO assess Africa country and what they've done concerning the lockdown and management of COVID-19? And then the second one, there's a news going around that vaccines are to be tested on Africa when it's developed. How true is that? And is there a way, is there a window that in the nearest future, vaccine will be developed for COVID-19? Thank you. Hello?
Yes, we are just trying to make sure that we understood the question. So, yeah, but we will try.
I think this is Nigeria, is it? Yes. Yeah. Maria may answer the question around vaccine development. With regard to our general assessment on lockdown, and the Director General may wish to comment on this because he's been speaking with many leaders in Africa, and I believe spoke with the whole of the African Union leadership and countries late last week. So therefore is in a much better position than me to speak about that. We would characterize, so far Africa is actually doing well in this response thus far. Countries have essential capacities for testing. Many countries are taking strong action and want to really focus on finding cases and doing contact tracing and trying to stop this disease becoming much more extensive, given the fact that health systems are not as strong in many countries. They need support in that, though. They need support in testing. They need support with protective gear, and they need to be given the resources to be able to mount those types of responses. So I would characterize that Africa has not suffered the worst of this pandemic so far. The worst of it can be avoided with very, very swift action to support those countries in Africa who really do want to take a comprehensive approach to this disease. With the many vulnerable people, including refugees and migrants who live in those countries, it is, I suppose, our responsibility to provide that support. But DG, you may wish to speak about your interactions with the African Union countries.
So I'll answer the question around vaccines. So what we can say is that there are a number of vaccines that are in development, and vaccines will be tested through clinical trials with all ethical considerations in place in whichever populations are under study, with informed consent, with open and transparent communication. This is of the utmost importance. Not only do we have strong, robust scientific evidence, but we ensure that all of the studies that are done with appropriate and the highest level of ethical considerations. One thing, if I could just mention on the first question around Africa, is that there are a number of countries in Africa right now which have very few cases. And Mike has alluded to this in his earlier response. Very few cases. Some only have imported cases. And there is an opportunity here. This window of opportunity that the DG has spoken about exists in many countries still. There is an opportunity to prevent the worst from happening in a number of countries across Africa and across countries that are still seeing their first case in some island countries. And we need to support those governments, those countries, all of the people in those areas to prevent the worst from happening, to prevent these individual cases from becoming clusters, these clusters from becoming community transmission. And I think that's where we need to put a lot of emphasis on and a lot of support on, so that we can prevent countries from reaching a point where they need to put in these very restrictive movement restrictions.